we're going to go over the second of the big three McGill exercises, and that is the side bridge. This is a really great exercise because it helps strengthen the quadratus lumborum muscles in your core, these muscles right over here, and make sure that your core is nice and stable, and that will help a lot with your low back pain, your sciatica pain, and just making sure that everything's nice and stable and staying strong in there. So while you're doing this exercise, make sure that your movements, you're not doing that bending there, that's causing a lot of your pain. You want to make sure your core is nice and stable, not all your movements are doing that. Alright, I'm first going to go over the modified version of this exercise, which is on your knees. So you're going to be on the ground on a stable surface, and you're just going to bring yourself down, making sure your low back is stable the whole time, and plant your elbows in the ground. And then you're going to bring your feet up and bring them back. You can scoot your butt back a little bit. That way you can bring your knees over here. You want to be in this kind of, diagonal position. That way when you drive your hips up, you'll be straight in your low back. And you can practice doing it. Drive your hips up like that. And I can check. I'm not all the way forward. My knees are forward, so I need to readjust. Bring those knees back a little bit. And then do it again. And that looks a lot better. I'm more straight in here. With this other hand, I can either stabilize here, put it on my opposite shoulder, put it on my hip, whatever is more comfortable for you, and hold that for about 10 seconds. That's fine. If you want to do longer, that's okay, but McGill usually recommends about 10 seconds. That's okay. And when you're done, just put your butt back on the ground, making sure you're not bending that low back, and then slide your legs forward, just like this. You use your other legs to help prop yourself up. That way the whole time, keeping your back nice and straight and not doing a lot of bending in there. Now to do the full version of this, you're going to have your legs straightened out. I'm going to try my best. This is a little short table, a little taller guy, so it might not work out that great, but we're going to try to do it. So same thing, bring your elbow down to the ground, and then you're going to bring your legs up and get into that position. And drive your butt back a little bit in there. And you're going to straighten your legs. Have the top foot in front of your bottom foot. It's going to make it a little bit easier if you want to do the log roll to plank position, but this is going to help you stabilize a little better. And then once again, grab your hips up, make sure you're straight. I'm doing alright with that. And then you hold that for about 10 seconds or longer if you want to. Once again, over here, that's totally fine too. And hold that. Bring your butt down to the ground. And for me, it's a little easier. I can just bring my legs up forward, making sure to keep that back straight. Push up right here. And that way I'm nice and straight while I'm doing that too. That's going to be a really good exercise to help you. Make sure you do it on both sides, because if you have two quadratus lumborums, your body as a whole, make sure we get both sides nice and strong, even if you're having pain on one side. Alright, this is the last part. I'm going to show you one more complicated steps, and that's basically you're going to do a roll into a front plank and then to your other side plank. So once again, like we just did with the straight leg one, not the modified side bridge, but the regular one, bring your leg arm down, bring the legs up, scoot your butt back. You already know how to do this. Bring those legs up, put the top leg in front of you, in this case my right foot, drive up, like that. And once I hit 10 seconds, I can move over into a normal plank right here. Hold that, again, another 10 seconds, go to the side, just like that. Hold right there, and you can come back to if you'd like, if you don't want to. And just the whole time, make sure your core is nice and stable, your back's nice and straight, you're not doing any bending forward, you're not arching it. You want to make sure that core is nice and engaged, that way it's helping you have that stable core and making sure that your low back pain can go away and your sciatica pain can go away too. One thing to keep in mind while you're doing these exercises is that you want to start with about 4 reps on each side and then switch to the other side too. So do it for about 10 seconds, rest in that resting position with your butt down, keeping that spine stable, go back up, and try to do 4 times. If you can do more, that's great, but start with about 4 or 5 and that's okay. Once you've done those 4 and you flip the other side, did the 4, you can go down with that pyramid style we talked about with the first McGill exercise, but going down about 2. So you can start with doing 2 of those. So 1, 10 seconds rest, another 10 seconds, and then rest. And then if you have more reps to do, if you did start with 5 and went down to 3, the next time you go around and do it, just do one of those reps. So going down another 2 for that. And if you just do it in increments about 10, those are perfect for helping with low back pain and sciatica pain. Thanks for watching the video today. I know this will help your low back pain, your sciatica pain, whatever pain you're having, or if you just want a stable core, really help you a lot. Make sure that you subscribe so you can watch out for more videos in the future. I'm going to be working on some more exercise videos for different parts of the body and just other cool things that I've been working on last couple months. So we'll see you soon, and I hope you have a great day.